Mastering the Rule of Nine, a comprehensive guide for adult burn assessment and Next Generation NCLEX review. The Rule of Nine helps nurses determine what percentage of total body surface area is affected by burns. It's an essential tool in high-pressure situations. Let's go over a few things you need to know about the Rule of Nine, and then we're going to do 5 practice questions so that you get comfortable. The Rule of Nine is an essential tool to evaluate burn victims by healthcare professionals. Assessing the burn injuries is required to provide immediate intervention. Nursing students have experience answering questions on their exam at some point in nursing to demonstrate the understanding of the Rule of Nine. So why do nurses need to know the total body surface area percentage that has been burned on a patient? We need to know the severity of the burn. We need to know what fluid treatment is required, especially during the initial 24 to 48 hours for moderate to severe burns. Lactated ringer solution is commonly the fluid of choice. To understand the Rule of Nine, you must remember the percentage of each body part. Let's take a look at the breakdown of how the Rule of Nine divides the body into sections. So let's go over some scenarios from this chart. If just the right front leg has sustained burns, then this is considered 9% of the total body surface area, also shortened for TBSA. If the right front and back leg has sustained burn, then this is considered 18% of the total body surface area. Keep in mind that the entire head and neck makes up 9%. The front of the head is 4.5%, and the back of the head is 4.5% of the total body surface area. Each arm makes up 9%. So if just the front of one arm has burned, then this area makes up 4.5% of the total body surface area. The entire torso makes up 36% of the body. The anterior trunk makes up 18%, and the posterior trunk makes up 18%. If half of the anterior trunk has sustained burn, then this is 9% of the total body surface area. Each leg makes up 18% of the body. Now, if both legs have sustained burn, then that would be a total of 36% of the total body surface area. If just the right front leg has sustained burn, then this would equate to 9% of the total body surface area. Then the perineum area makes up 1% of the total body surface area. Let's dive into some Rule of Nines practice questions. But hey, just a heads up, because this rule is such an important rule, I've got the Rule of Nines as one of my flashcards in the medical surgical deck. If you still haven't already, swing by qdnurses.com/start and sign up for my email. You will snag 160 digital flashcards for free. Now, let's get NCLEX ready together. Ready for question 1? Nurse Camille is providing care for a 30-year-old male patient that has been brought to the emergency department after sustaining burns from a house fire. The nurse noted that the patient has full thickness burns on the front of the right leg and the entire right arm. Using the Rule of Nines, what percentage of the patient's total body surface area is affected by burns? A, 18%, B, 36%, C, 45%, or D, 24.5%. You ready for the correct answer? The correct answer is A, 18%. Now let's go over the rationale. According to the Rule of Nines in adults, the front of the leg accounts for 9% of the total body surface area. The entire right arm accounts for 9% of the total body surface area. Now, adding 9% and 9% together results in the total body surface area affected by burns in this patient to be 18%. Therefore, the correct answer is A, 18%. On to question number 2. Nurse Goku is providing care for a 25-year-old female patient that sustained third-degree burns on the front of her torso and the entire left arm. The nurse will use the Rule of Nines to calculate the percentage of her total body surface area that is affected. Which of the following is the correct answer? A, 18%, B, 27%, C, 36%, or D, 45%. You ready for the correct answer? The answer is B, 27%. Rationale. According to the rule of nines in adults, the front of the torso is 18%, and the entire left arm is 9% of the total body surface area. Adding 18% and 9% together results in the total body surface area affected by burns in this patient to be 27%. Therefore, the correct answer is B, 27%. Awesome job, guys! Let's move on to question number 3. Nurse Luffy is providing care for a 36 years old male patient that sustained burns on both legs and the perineum. The nurse will use the rule of nines to calculate the percentage of her total body surface area that is affected. Which of the following is the correct answer? A, 18%, B, 19%, C, 36%, or D, 37%. Ready for the correct answer? The correct answer is D, 37%. Let's go over this rationale. According to the rule of nines in adults, each leg represents 18%, and the perineum represents 1% of the total body surface area. 18% plus 18% plus 1% equals 37% of the total body surface area that has sustained burns. Alright, we're ready for question number 4. Nurse Naruto is providing care for a 45 years old female patient that sustained burns on both arms and the entire right leg. Calculate the percentage of the patient's total body surface area affected by burns according to the rule of nines. Fill in the blank. And the correct answer is 36%. So let's go over the rationale. By now, you are a pro at calculating the total body surface area affected by burn using the rule of 9. So we don't need multiple choices anymore. Not to mention, this is the perfect scenario for the NCLEX to provide you a fill in the blank. So according to the rule of 9s in adults, each arm represents 9%, which totals 18%. Each leg represents 18%, and in this scenario, only the right leg is affected. So 18% plus 18% equals 36%. Awesome job, guys, for your fill-in-the-blank correct answer. And final question. Nurse Gray is providing care for a 50 years old male patient that sustained burns on the front right arm, the entire back torso, the entire front torso, the back of the head, and the genitalia area. Calculate the percentage of the patient's total body surface area affected by burns according to the rule of 9. Another fill in the blank, and that's perfect for your last question. But I believe in you. So, you have the correct answer? The correct answer is 46%. So let's go over the rationale. The front right arm makes up 4.5%. The entire back torso makes up 18%. The entire front torso makes up 18%. The back of the head makes up 4.5%, and the genitalia area makes up 1%. 4.5% plus 18% plus 18% plus 4.5% plus 1% equals 46% of the total body surface area has been affected by burns. You just completed Rule of 9's practice questions. I am so proud of you. Did you get all 5 correct? If not, hit the replay button and get yourself comfortable with my rationale. That's what I'm here for. Looking for more tips and tricks to make your journey even more fun and engaging? Check out my next video where we dive into more essential nursing school hacks. Thanks for dropping in and see you in the next video.